I'm going to give you a brief background of it, what the goals of the health plan are, and what the status is now. The background of the National Equine Health Plan was thought up in 2010 after the Ogden, Utah outbreak, and it's when the industry came together, AAEP especially, with the American Horse Council and state animal health officials, came together and sat down at the American Horse Council convention and thought about, okay, what do we do if there's another outbreak like what happened in Utah, and how can we mitigate the economic impact of such an outbreak? And what was devised was the National Equine Health Plan. And the health plan is a set of guidelines, not specific to any facet of the industry, but it's just a set of guidelines where it'll help increase biosecurity. It'll look at different aspects of, okay, so a racetrack might have might have a certain set of circumstances that they're under as compared to a breeding farm or a show. And what the health plan achieves is just common guidelines that'll give industry and state animal health officials something to go off of if there's some sort of uniform accordance. All right, the mission of the health plan is to protect the health and welfare of the U.S. equine. It establishes the role of industry, what their job in the health plan is, what the role of the state and federal animal health officials is, and how does it all come together and to improve equine health. And Josie will talk more about the communication center. The biggest thing I believe in the health plan is facilitating the movement of horses both domestically and internationally, because if there is a major outbreak, you're going to see horses not being able to move for fear of they might be infected, and people at different shows later on don't want these horses around. Here we go. So this is the history of it. Next slide. All right. These are the goals of the health plan: protecting the economic viability of industry through education, raising awareness for common diseases and ways to mitigate them. We're going to start off. The health plan is going to focus on one disease at first. It's sort of beta testing. That's going to be EHV1. What to look for if a horse shows signs of a disease. This is something that can be done not only on the farm level but also at the track or at the show by not necessarily a veterinarian, but if an owner or a trainer sees a horse is not doing well, if their temperature has risen, that's a key indicator that something's wrong, and they'll go into the plan, okay, what do we do now? We're going to keep watching this horse to see if its condition improves or deteriorates. Biosecurity, disease mitigation especially, making sure you're using clean nose rags, not sharing needles or anything like that. Dr. Katie Flynn from the California Department of Agriculture has a biosecurity toolkit for horse shows, and it's very good. It shows pictures of what's right, what's wrong, what can be changed, and it can be tailored to a show, a track, a farm, anything. And Dr. Heckendorf's business continuity plan, what are shows going to do in response if there is an outbreak, and how are shows going to work with the exhibitors. International, interstate and international movement is very important. If horses don't move, the industry will come to a standstill. Dissemination of information, that'll be what Josie talks about in the Equine Disease Communication Center. Right now we're working on finalizing the uniform guidelines and protocols with the industry, the uniform guidelines for shows, farms, tracks, etc. It's very, very broad and general, but we need to raise awareness to people with just one horse in their backyard that may not ever travel all the way up to tracks where they can be 2 or 3 horses there. Drafting toolkits, education materials for industry to use. I believe the American Quarter Horse Association already does something along these lines with their membership, but I would like to see more outreach on the extension level, work with state extension offices. A lot of kids show horses in 4-H and through their schools and with the ag classes, teach basic biosecurity practices to help, to help keep the horses healthy. A healthy horse is a healthy industry.